Welcome to Success, the program designed to help you scale up cervical cancer elimination with secondary prevention strategy. I'm Winthrop Morgan, and today I'll be presenting our novel approach to enhancing scale up and sustainability of cancer prevention initiatives in low and middle income countries through a toolkit that we call collaborative cost review and analysis. This approach builds on the efforts by the World Health Organization to standardize cost projection and retrospective costing methods in cervical cancer elimination. WHO began the work on the cervical cancer prevention and control costing tool, the C4P, in 2011. And their objective, and our continuing objective, is estimating the value of additional resources required to add cervical cancer screening and treatment to an existing reproductive health program. Here you see us working on field testing the tool. The tool helps stakeholders estimate the coverage they can achieve by implementing a cervical cancer prevention and control scale-up strategy. Using inputs from stakeholders themselves, it outputs estimates of the costs for screening and treatment incurred under a scale-up. The tool has many features built in that allow the stakeholders to vary inputs, such as coverage goals, unit costs, service models, and more. But a tool is a tool. And when we field tested the tool, we learned several lessons from our experience. First, and we were delighted by this, we found that primary stakeholders really enjoyed the chance to talk with their fellow primary stakeholders about specific plans and resource allocations. They repeatedly said to us that they made substantial progress in forging alliances and networks during the costing process. Second, we learned that collecting valid and reliable inputs for a costing tool requires inside assistance. If the people who hold that information don't feel ownership or investment in the work, they're not going to make that extra effort needed to ensure the right inputs are provided for the tool. And third, as I said, we learned that while a tool can help with scale-up success, it needs more than just a user manual to move a scale-up forward. And so the next step we're undertaking is through the Success Project, which is a joint effort by Expertise France, JPIGO, UICC, and Untitled. Under this project, we're developing what we call the C4P-SUCCESS toolkit, and it's designed to guide managers, program managers, and policymakers through a methodology we call collaborative cost review and analysis. Under this project, we'll prepare and publish a set of ready-to-use materials for planning and facilitating a collaborative cost review and analysis. The tool will include, but it won't be limited to, a success version of the C4P tool, which will now include costing for high-risk HPV testing. It will include data collection worksheets, presentation templates, workshop curricula, and multimedia course materials. The tools are going to be presented in a practical manner, and they're going to be presented in a way that can be adapted and edited for different environments. We have three objectives during this project. The first thing is to test the collaborative cost review and analysis method in 4 countries: Burkina Faso, Cote d'Ivoire, Guatemala, and the Philippines. And our objective there is to turn scale-up strategies into costed implementation plans in those countries. The second is to deliver a field test toolkit for costing cervical cancer secondary prevention scale-up strategies in low and middle income countries to the Success Project, which has more than 4 countries with which it's working. And the third is for us to share with cancer elimination community how viewing scale-up strategies through the lens of costing can lead to more effective, efficient, and practical plans. We have 6 stages to our methodology that we're using. The first involves developing and testing cost readiness assessment toolkit materials. Costing readiness materials include a self-administrated questionnaire to determine if there's need for analysis and review of an existing scale-up strategy and plan. It includes a script to orient stakeholders to the proposed review and analysis, and it will also contain a checklist for confirming the readiness of a country to undertake a C4P success activity. And at this point, we're also going to be providing an example multimedia orientation for people to follow or to use as an example. Our second stage of our methodology is going to be to develop and test orientation recruitment materials for the toolkit. The materials are going to include a stakeholder analysis tool to help determine who the primary stakeholders are, and it's going to include recruitment plans for ensuring that the right representatives from the primary stakeholders are provided to form a scale-up implementation coordination team. These materials will also include a suggested initial orientation activity for prospective team members. And finally, it's going to include a template to document the strategy and plans that the team has agreed to review and analyze. The third stage of our methodology will involve developing and testing data collection and input exercises. Our intention is to guide the team through collecting the required data and assumptions that they need for populating the Success C4P tool. We'll be testing alternative approaches to inputting the data and assumptions to the tool. Now, we aren't sure if we can depend on the team members doing this from past experience, so we'll be exploring other options as well. Our fourth stage will involve developing and testing collaborative review and analysis workshop materials. Now, this is a critical point for our methods. This is when team members verify and stipulate that the assumptions and inputs of the C4P tool that we put in are correct. They also review the projected outputs and cost estimated by the tool. Now, usually the teams want to test how changing certain assumptions and inputs affects the projected outcomes and costs. And it's also a time when stakeholders engage in sidebar conversations and sometimes collective conversations about who's going to do what, to agree on their respective roles and responsibilities. Now, the desired output of this retreat is a collectively endorsed operational plan with costs attached. In the past, we've left that to the participants to do on their own, not the retreat, but presenting the outcomes. This time, however, we have a fifth stage, and that's to develop and test presentation materials, memorandums of understanding, and other sharing templates. Our intention here is to ensure that the participants use and share what they've developed during the review and analysis exercise. So as I like to say, it doesn't just become another very expensive paperweight. Finally, we intend to review and revise the materials we've created and field tested, prepare them for publication and sharing by the Success Project. We know that the results are anticipated rather than what we've already achieved, but they are based on what we have achieved in the past during our field tests of this tool. The toolkit's coming in 2022, but we do anticipate that after implementation of this collaborative cost review and analysis process, that we're going to see clear agreement among the key actors of their roles and expected resource needs. We've seen that before during our field tests. We think that we're going to see it again. And we also believe that they're going to be better able to analyze comparative cost benefits, cost effectiveness, and cost efficiencies of alternative implementation scenarios. We do think that there's going to be fewer funding gaps because donors recognize that the proposed scale-up implementers have really carefully analyzed both their intended activities and their resource requirements relative to their means. And we anticipate that the scale-up implementation coordination team this time, the ones who went through this exercise, will continue to invest in and champion cervical cancer prevention activities in their countries. Ultimately, we anticipate providing the cervical cancer elimination community, that's you, with a novel approach to moving from strategy to success. On behalf of my co-authors and myself, I'd like to thank you for your interest in our work and your attention. We'd also like to acknowledge the support of Expertise France, JPIGO, UICC, and UNITAID, and the World Health Organization for their work. I'm going to take questions now if you have them. I'd also like to hear your comments. But if you want more information and updates about how we're progressing, please feel free to contact me and the other authors through me at the email address that you see on the screen. At this point, I'll say thank you, and we'll move forward from there.